Welcome, it's Trudy Scott here, food mood expert, certified nutritionist, author of the Antianxiety Food Solution, host of the Anxiety Summit. And today I've got the pleasure of interviewing Dr. Mark Hyman, who is the creator and host of the new Broken Brain series. And I'm just really excited to be here. I've been such a fan of yours for so many years. I know my community knows who you are, and they're really excited about the Broken Brain series. So I wanted to get together with you and just give some highlights and talk about, firstly, why you created the Broken Brain series. And you've got a story behind your passion about it.
I do. Thank you for having me. Yeah, so about 20 years ago, I went from being a very healthy young doctor to having a broken brain and a broken body. And it turned out it was from mercury poisoning that I got when I was in China. And I just developed severe chronic fatigue where I couldn't focus, I couldn't remember, I couldn't think, I couldn't pay attention. I was depressed, I couldn't sleep, I felt just completely not myself. And I, through that journey, was able to discover this world of functional medicine, which I thought was fairly developed at the time, but it was really just in its infancy. And through discovering functional medicine, I was able to repair my own system and fix my broken brain. I began to apply this with patients, seeing all kinds of things without really knowing what I was doing. I just was treating people's physical systems, fixing their gut, helping their immune system, cleaning up their diet, optimizing their nutritional status, balancing their hormones, and all their mental problems would get better. Their anxiety would get better, their depression would get better. And I wasn't actually treating the depression or anxiety. Autism, ADD, memory issues, dementia, all these things would start to get better. And I began to realize that the body was driving a lot of this brain dysfunction. And that if you fix the body, a lot of the brain disorders would get better. That it wasn't primarily a mental problem, but it was a physical problem. Just as there's a mind-body effect, which is real, there's also a body-mind effect. And that hadn't been really talked about. So I wrote a book called The Ultra Mind Solution 10 years ago, which outlined this model. And then really this has been an incredible 10 years of brain research that I felt needed updating. And so we created a documentary series online looking at the new research and how this applies. And the things that I noticed 10, 15, 20 years ago are now becoming more and more accepted and understood as real. And so we're able to actually work with people in a very specific and direct way to help heal their broken brains and help people recover from things that we thought were really irreversible. Not just anxiety and depression, but ADD, autism, dementia, Parkinson's, all sorts of issues that affect the brain that have a very different approach that can be used to help repair and heal.
It's so powerful, and I love that you talk about the effect that the body has on the brain, because we know about mind-body medicine. Mm-hmm. You talk about that in the series, how we can use our mind to affect our health. But you use this term, tell me what the term is that you use that talks about how physical issues in our body, nutritional deficiencies, imbalances, can actually affect the brain.
You mean the body-mind effect?
Yes.
Yeah.
You give it a term, it was called, not psycho...
Oh, somatopsychic.
Somatopsychic, yes.
We think of psychosomatic, but there's also a somatopsychic phenomena. I always say, if you have mercury poisoning, or you have a thyroid problem, or you have abnormal gut flora, or you're vitamin D deficient or B12 deficient, it's very hard to have a proper functioning brain. You can't just say, oh, someone's got depression, that's what's causing their hopelessness and helplessness and sadness, and maybe many other things. It could be psychological, it could be a trauma, but it also could be so many other factors, and they often are overlooked and ignored. And when I start peeling back the layers of what's happening with these people and looking underneath the hood and looking through the functional medicine lens at the body as a system and correcting the imbalances, I mean, it's shocking to me what happens. I always remember when I started applying this, I was like, wow, you got better? I can't believe it. Like, you shouldn't really get better according to Western medicine.
Yes. Amazing. And you mentioned trauma, and even if someone has experienced trauma, if their nutritional status is good, they're able to deal with it better.
Right.
And maybe have less symptoms of
That's
post-traumatic stress if they
right.
have a good nutritional status. And there's a lot of research supporting that.
Absolutely.
And you talk about that in the series as well.
Yeah, absolutely. Your brain has the ability to be resilient. But if you're nutritionally depleted, if you're having all sorts of inflammatory problems, if you're eating foods you're reacting to and are allergic to, your brain can't work properly, so your baseline is going to be much lower. But if you fix all those things, then your capacity to deal with your psychological issues, it's not that they don't exist, it's that your ability to cope with them, to work through them, to heal and repair the more difficult things, which are, early life traumas or abuse or addiction, these are much easier to deal with once you've sort of fixed the basic sort of constitution of the person.
Now, one thing that you talk about a lot in the Broken Brain series, which I really appreciate, is the fact that there's so much over-medication.
Yeah.
Can you touch a little bit about that? And I know with your story, you also had anxiety and depression, and you were prescribed medications as well. So this is common.
Yeah.
The benzodiazepines, SSRIs, you talk about antipsychotics. You shared some pretty scary stats on the increase that we see.
Oh, it's, when you look at, it kind of goes up and down, but psychiatric medication as a whole is the number 2 or 3 most prescribed category of drugs in America, increasingly across the globe. And it's being used instead of dealing with the real issues. And they don't really even work that well. I mean, anxiety medications can work, but antidepressants have been shown really not to work that well for mild to moderate depression. For severe depression, they can be helpful, and they can be life-saving for some people, but they're not a panacea. And I think, when you look at, when I was a kid, there was that one kid in the class, Patty Ainsworth, who was a troublemaker. Now it's like, 10% of the class is on ADD medication. That's a problem.
It is.
And when we see, 1 in 4 people have depression in their lifetime, and if the knee-jerk reaction is medication, it can just sort of gives people a sense of numbness, but it doesn't really deal with the issues. So I think we are way over-medicated. And on top of that, there's pushing of medications for what we call off-label use, which means they're not approved for those indications. So they're doing this for kids with antipsychotics, and they've actually been sued. So the pharma companies have been held liable for promoting these drugs for off-label uses, which they're not allowed to do, for kids. They get fined billions of dollars, but they don't care because they've made umpteen more billions, and they just see it as a marketing expense. So it's really discouraging to see what happens with the pharmaceutical use in this space, because even with, for example, like ADD, it's so fixable by dealing with the root causes, and most of us now are just not even trained how to think that way.
Well, that's why I love the Broken Brain series, because it offers a message of hope, it offers some practical solutions, and it empowers the person who's suffering from the brain disorder, whatever it is, anxiety, depression, dementia, you name it, empowers them with solutions. Mm-hmm. And I think the other important thing is it's going to give curious practitioners who are not on board with this functional medicine approach some insights into what the future may hold, which I think is very promising.
Yeah, it's very powerful. And I remember this guy who read my book, The Ultramind Solution, which is really what the Broken Brain series is based on. And he was a doctor, and he had a kid with autism. And he said, well, we were so desperate. Our kid was 5, he wasn't talking. We just started with the diet. We just got him off gluten, casein. And a few days later, all of a sudden, he started talking in full sentences. And this is a skeptical physician who witnessed this. And I see this all the time. I have patients, for example, who have Alzheimer's or dementia, or diagnosed with dementia. And it turns out they have other issues. They have heavy metal poisoning, or they might have Lyme disease in the brain, or they might have severe nutritional deficiencies, or they might be insulin resistant with high levels of sugar in their diet that are affecting their brain. And you can fix those things. There may still be issues left over, but it's going to be much easier to deal with those after.
Get to the root cause and address those root causes.
That's right. That's the purpose of functional medicine, which is a medicine of why, not what. And we have all these labels, and I say, if someone comes into my office and they're hopeless and helpless, have no interest in life, can't focus, can't sleep, don't want to have sex, we go, I know what's wrong with you, you have depression. But depression isn't the cause of those symptoms, it's the name of the symptoms. It doesn't tell you what's really wrong with that person. It could be a host of things, from low thyroid to gluten, to mercury poisoning, to vitamin D deficiency, to B12 deficiency, to insulin resistance. All these factors can lead to depression. Same syndrome, but different causes. So I'm much more interested in addressing the causes. Then you don't have to use the medication.
And some people can have an issue with gluten and have autism symptoms, and someone else can have depression or anxiety or dementia. So it can affect different people.
Well, that's a very good point. So in functional medicine, we see that one disease can have many causes, but on the other hand, one causative factor can create many diseases. For example, heavy metals may cause dementia or autism, or depression, or anxiety, or insomnia, or gut issues can cause all these various things that are not, one disease. Or for example, gluten, like you mentioned, can cause autoimmune disease, can cause cancer, can cause diabetes, can cause osteoporosis, can cause anemia, can cause depression, can cause even dementia. So how do you sort of begin to think about it? Our current naming of diseases doesn't make any sense. So all the labeling, if you look at the diagnostic criteria, we have something called the DSM-5, which is the Diagnostic and Statistical Manual that categorizes and catalogs all the psychiatric disorders. And they're all categorized by symptoms. So it's all descriptive. It says if you have these 5 symptoms, you have this, right? But it doesn't tell you why, and it doesn't really help you other than giving you a label, which doesn't mean anything about helping you understand what's really going on.
And then you're on a medication that's going to give you side effects and not actually get to the root cause of the
Right.
problem. And yeah, just making these nutritional changes, addressing the thyroid, getting off gluten, addressing the gut, the big section in the gut,
it's
is
huge.
The gut-brain connection. So
we're just learning about this. For example, for years, one of the main ways I treated the brain was fixing the gut. And that means optimizing the flora, getting rid of bad bugs, helping heal leaky gut. And we just did it. We didn't really have a very deep understanding other than we knew the microbiome was important. But now we know, for example, there are more bacterial molecules in your blood than your own molecules. That you have 10 times as many bacterial cells in you as your own cells, 100 times as much bacterial DNA, and that DNA is all producing proteins, and all those proteins, literally you have 20,000 genes, there's 2 million genes for bacteria in you, and they're all producing molecules that are entering your bloodstream and driving all sorts of biological reactions that aren't even human molecules. So we have to begin to sort of, how do those affect the brain and what's going on? And it's very powerful.
And so much research in this area, it's just growing and growing. So you mentioned earlier that you wanted to do this because of all the new research, and there is so much research on the gut-brain connection, nutritional psychiatry. Dr. Drew Ramsey talks about this recent study on depression and just getting people onto a real whole foods diet, and how 30% saw remission of symptoms, just changing their diet, not even going gluten-free. So it's powerful. These small changes can have powerful effects.
Profound effects.
Well, thank you so much for your wonderful work that you do and for making time today. And I highly recommend the Broken Brain series with Dr. Mark Hyman and all the wonderful experts.
Oh, so many. We have 57 experts.
Amazing. Some of our favorite functional medicine practitioners.
Yeah.
Thank you.
Thank you.